Everyone. This is the Thursday, October 14th. It's a special Westwood School Committee meeting. To begin, I would like to do roll call. Charlie Donahue,
Yes.
Tony Mullen,
Here.
Amanda Phillips,
Here.
and Carol Lewis is not joining. She is out of the country. Okay, I'd like to recognize the live broadcast and online stream available through Westwood Media Center and also online at www.westwood.k12.ma.us/live to provide real-time public access to the activities of the school committee in accordance with an act relative to extending certain COVID-19 measures adopted during the state of emergency. So we have one item on the agenda, and that is the policy regarding face masks. So we are going to go straight to public participation. I want to let everybody know that public participation today, because this is a special meeting, is limited to the one agenda item, which is the face mask policy. If you care to discuss anything else related to the schools, we do have our regularly scheduled meeting next Thursday, September 20th. So you are welcome to provide your public comment at that meeting at that time, but we will be limiting comments today specifically to the agenda item of face masks. Okay, so I just want to remind everyone of the public participation rules. I think we are raising hands to speak. You will be unmuted. We ask that you provide your name and address before you speak, and you have 3 minutes. And that's it. All right. So is there anyone, Paul, with their hand raised?
Not that I can see, no.
Okay. Is there anyone on the phone that wishes to speak?
We have two hands up now. Heather
Okay.
and Carlo Rosen.
Okay. I see Heather Morrison first. So why don't we unmute Heather and let her speak? Thanks.
Hi, everybody. Can you hear me?
Yep, we got you.
Thanks. Heather Morrison, 74 Magnolia Drive. I'm just calling to ask you to please support the DESE guidance related to the mask mandate. DESE and DPH have agreed to this metric. These advisory groups are made up of some of the best experts in the country, and I ask that you please listen to them. Many states and countries across the world have successfully returned their children back to normal, and we can too. The evidence on mask effectiveness is not clear. If it was, then countries across Europe would have seen increasingly terrible outcomes because they did not mask their children. But they have not, and in fact, their cases and hospitalizations are in many cases far better than ours in the United States. When I hear our Westwood teachers explain how difficult it is to teach a foreign language while wearing masks, or how they see the quietest students further distance themselves from socializations because their voice cannot be heard, my heart breaks. Our district exceeds the target vaccination rate, and our testing program is in place. We are not seeing spread or even many cases in school this year. It is time for Westwood to move forward and allow our children to speak up in class and be heard. It is time for our children to see expressions on each other's faces. Before you make your decision today, I ask you to consider, have you ever worn a mask for 6 hours a day, 5 days a week? It is not easy. It is uncomfortable. It's difficult to read expressions and to talk to people. These kids have been through enough over the last year and a half. It's time to start small and allow the high school to unmask, and then let the data drive your decisions. I urge you to follow the DESE guidance regarding masks. I think that we all agree that it is not perfect, but we don't want perfection to be the enemy of progress. It is time to move forward. Thank you.
Thanks, Heather. Next in the queue I see is Carlo Rosen. If we could unmute Carlo.
All right, thank you. Carlo Rosen, 180 Partridge Drive. I'm a physician. I will say couple comments. First of all, just to comment to the last person, there actually is very good literature, medical literature, in the medical literature that masks are effective. So I'd actually recommend to continue the current mask guidelines. I do think that it's too early. Unfortunately, it's too early to remove the mask guidelines. I think that we're actually in a place very similar to where we were in August in the beginning of the school year. And actually, in terms of the metrics and in terms of COVID in general, and the metrics that I'm referring to are, we're at pretty similar vaccination rates for the high school as we were in the beginning of the school year. We are actually in slightly worse state in terms of community spread of COVID. And the metrics that we should be using are not just sort of the vaccination rates, but also the CDC community spread rate, which in the beginning of the school year was substantial. As of today, even compared to last week, we're actually up in the high transmission rate. And that is probably the most important metric aside from the vaccination rates. And we should really wait until we get down into the low transmission rate before we decide to remove masks that are proven to work. If we remove masking, we would be going against CDC guidelines. We would be going against the American Academy of Pediatrics. We would be going against the Massachusetts Medical Society. And we would be going against every single major hospital in the city of Boston that is currently requiring masking for its employees, not just because of the risk to patients, but because of the risk to the workforce that are very highly vaccinated and a very similar situation to what we have in the high school. So it is unfortunately premature to stop wearing masks now. It is safe. And I would say actually it would be irresponsible to stop doing that based on all the things that I've talked about already. We'd be going against the CDC and other national and state guidelines, as well as some of the best medical institutions in the country.
Okay, thank you, Carlo. I see Antigone Grasso with a hand up, so can we unmute Antigone?
Hi, Antigone Grasso, 44 Oak Street. I just wanted to actually echo what Heather said, and it is important to follow the DESE guidance. My comments at the last school committee meeting, I think were clear that the DPH has endorsed those guidelines. And the DPH, I don't think would endorse anything that they thought would put anybody at risk, staff or students. And as your prior caller, I think, is really showing, you could find any physician, pediatricians, infectious disease experts. You look on Twitter, you look across any sort of articles that have been published over the last year. And the issue is that there is no agreement. That has been the issue this entire pandemic. There is no consensus, period. So depending on who you ask, you will get a different opinion. And that is why we have to follow what the DPH has endorsed. Otherwise, you will have 350 towns having their own policies about a pandemic in a very highly vaccinated state. I would encourage you again to follow the DESE guidance. It was endorsed by the DPH. The DPH is not intending to do any harm. Again, I can't imagine they would endorse anything seeking out medical experts if they thought it would create any harm to students and staff. And I want to reiterate that the CDC and the AA and the American Academy of Pediatrics came out with guidance for the entire country, not for Massachusetts specifically, the entire country. And those standards and what's going on in different states across the country are very different. We in Massachusetts did our jobs and got vaccinated. The students of Westwood in the high school got vaccinated. Those rates that Jared Orsini sent out are tremendous. It is time to allow the guidance to be followed at the high school and to lift the masks. Thank you.
Thank you, Antigone. I don't see any other hands raised. Is there anyone on the phone, Paul?
Not that I can see, no.
Okay. All right, thank you. At this time, I'm going to close public participation, and we are going to move to the next item on the agenda, which is the discussion item. Emily, I know we had asked you for some information. Do you want to?
Sure. Let me just call up just have a couple of slides with the information that you had asked for. So we have done some work to, one second, we've done some work to assess our vaccination rates at the high school. So our school nurses are able, through the state's MIIS portal, to figure out what our student vaccination rate is. And based on that process, we've determined that the high school vaccination rate among students is 82.4%. Our vaccination rate among staff, and that includes our employees, but also contractors and coaches who occasionally come in contact with students, that rate is 94%. And so when we put those together and look at the entire high school community, we are at 86.3% vaccinated. You had also asked for some information about how the weekly pool testing program is going. The answer to that is a little bit complicated. So the program is finally off the ground across the district. It was a little difficult to get it going this year, given some of the changes at the state level, but we are off and running. At the high school, 51% of students are registered. In other words, have provided consent to participate in the program. That's 491 out of 960 students. That number is a little skewed because 213 of the 491 registrants are seniors. We had a big senior event, a senior boat cruise, and students were required to test before and after that event. And so that the number of registrants went way up because people participating in the cruise took advantage of the on-site testing. So if we disaggregate it, then in grades 9 through 11, 39% of students are registered. At the high school, as opposed to elementary, where if you're registered, you are pretty reliably participating, at the high school, students basically self-report to the testing site or not. So the number of students that are registered doesn't necessarily tell us what's actually happening in terms of testing. So I've provided 3 weeks of participation rates that you can see here. So the week of September 3rd, 27% of students participated. October 5th was 26%. And then this week, October 12th, 11% of students.
And Emily, is
Yep.
that, let's say this past week, 11%, is that 11% of the student population or 11% of those registered?
It's 11% of the student population.
Okay.
So 102 kids out of the 960.
Okay. And basically 102 kids out of the 491 that are actually registered.
Yes, that's correct.
Okay.
Correct. Yeah.
Emily, do we have any idea of how this compares with other towns? Are we way below or way higher than other towns with regard to kids who are registered to be tested?
I have to say, Charlie, I don't really honestly have a sense of that at this point. I think, to be frank, we actually have been ahead of a lot of districts in getting the testing program off the ground. There are some districts who haven't even started yet.
Yep.
And so I don't really have a good, like, comprehensive sense of what's happening. At the elementary level, our numbers are a little higher. I think they're hovering about 60%. And as I recall, that's about where we were last spring. And my sense was that a lot of communities similarly had about that percentage. Some were higher.
Would it be worth an effort to find that out, maybe with other towns working and cooperating with us? Because my guess is if there are a lot of towns that are doing much better than us, it might be a way to kind of educate some of our own citizens that, we're not doing too well. And the other thing I wanted to ask about was the test and stay program. How well do our parents know that in many cases, their kids, if we find kids who are positive, their kids may be asked to stay home for 10 days, whereas if we could test them, they could stay in school. Am I correct in that?
That's correct. And I mean, I believe that parents are aware of that option. We have messaged that out several times at this point. You know, our experience is so far that that when there is a situation where we have in-school close contacts, we often have a portion of the close contacts who are already registered for test and stay and sort of immediately go into the protocol. And then there's often a portion who are not registered, but when faced with the actual real choice, right, in the moment of now we actually need to know, do you want to test and stay or not? That typically people do register their students for test and stay at that, you know, at that time. That's what we're finding.
Am I correct? Last year, we found over approximately 300 students and teachers who were asymptomatic. We picked them up by doing the testing. And if we hadn't have found those 300 with that testing, that would have been another spread from 300 people that we were able to stop.
So that isn't to my recollection that we had that. I don't think we had that many positive pools last year. I would have to go back and check the statistics, but I think I would remember if we had had 300 positive pools, because every time we have a positive pool, it's a big process. So I think it was considerably fewer people, cases that were sort of caught, if you will, through the pool testing. I can tell you that this year, to date, we have, correct me if I'm wrong, Abby, I think we've only had one positive pool so far this year. Is that right?
We have had one positive. Yep.
Yeah, one positive.
Was that high school or elementary?
That was elementary. So that just brings me to the last piece of information, and that is sort of what is happening with COVID cases in the schools right now. So currently we have 7 student cases. They are all at Sheehan, mainly in 2 classrooms. I think it actually is a good example of the test and stay protocol at work, because having had someone test positive, we then subsequently have discovered that some other students tested positive by using test and stay. We also currently have 2 staff cases. One is at Sheehan and one is at the high school. In terms of cases this year to date, we've had 27 student cases, 3 at the high school, 2 at the middle school, and 22 at the elementary. For our students, all but one of them, all but one of the positive cases were in unvaccinated individuals. You can see clearly it's skewing elementary. And we have had 5 staff cases this year. Our staff vaccination rates are very high. All of those folks were vaccinated and had a breakthrough case. And I think there was one other statistic you had asked, and that is what percentage of students at the high school have siblings in other buildings. The answer to that question is 32.7%. And I have not been able to ascertain, but I'm working on, because that number would include 7th and 8th graders as well. So we're trying to disaggregate that as well for you.
Okay.
Thank you.
Thanks, Emily. I think, so, and then I know we also got a letter from the Board of Health. We had sort of reached out to them and said, what is your, opinion? And I think the letter essentially says that while we seem to be trending well in the sense that we're not increasing, it seems the cases seem to be flat. They would recommend keeping the mask mandate in place as long as the county is in a substantial or high transmission category. Is that correct?
That was my understanding of the letter.
Was that how you guys, everyone else read the letter?
Yeah, and then Mr. Orsini is on the call if he wants to opine, but that's my understanding.
Okay. Okay. So we have that piece of information. Do we know what other towns, has anyone announced? I know there was some news about Hopkinton, but I believe it was erroneously reported.
Yeah, that wasn't accurately reported. I read the communication that the superintendent sent out to the Hopkinton community. So Hopkinton submitted their attestation, like they did the paperwork with DESE. But in fact, their school committee isn't voting until next week, I believe. So no decision has been made, and I don't want to further perpetrate perpetuate false information, but my understanding is that their Board of Health is weighing in on it as well. You know, what I have gleaned is that several communities surrounding us have announced, well, their boards of health have mask mandates in place for public buildings, and they have extended those until at least November 1st. And so it's kind of taken the possibility off the table for many school districts. So I'm not aware of any district at this point that has invoked the exemption yet, but you know, there may be districts that I'm not aware of.
Right. And I think the reason we're having this meeting today is because the exemption goes into effect tomorrow, correct? But as far as,
yes,
right.
It's October 15th is the date upon which it's possible to.
Right, it's possible. So, but as of this point, we don't know of any school districts who actually will be doing the exemption as of tomorrow.
No, I don't. And I've inquired, obviously, of other
Right.
area superintendents, and they've indicated that, you know, their school committees are not considering it at this time, and perhaps we'll look at it in November.
Okay. All right. I'd love to hear from everyone. What do you guys think?
So I guess I have a few thoughts. I guess first as context. I mean, I think it's important to think about the context of why we even got to this mask mandate in August, which, if you remember, DESE back in June was saying we're out of the business of any of these. And that was largely because transmission had gone so low in kind of that May, June period. And actually, if you even look back at the data in Norfolk County, we didn't actually hit the substantial kind of the third category until kind of early August, right? So kind of the summer was kind of, so I think it's kind of that context is important. It was really the Delta, but not just Delta, but more the transmission of Delta that really drove, I think, DESE kind of implementing this guidance. So I think that's one context. I think Dr. Rosen's context is that we are basically around at the same point, at least at the county level where we were in September. So we're not, to your point, man, not getting worse. You know, I'm not an expert epidemiologist, and you follow the New York Times tracker, do seem to think that certainly at the country level, we've hit peak for the Delta. And if you look at the country level, certainly the data has gone down in cases and hospitalizations over the last 2 to 3 weeks. So hopefully that will trend in the right direction. So I think that context is important. I think, you know, we aren't, at least I'm not a public health expert, but I think the letter from the Board of Health should weigh on our decision. You know, we're in Westwood, and they obviously are the experts. You know, ideally, the state, as we've talked about, would have given guidance, but Beacon Hill continues to advocate on this. So in absence of that, I think what we talked about at least the September meeting is following the guidance of the Board of Health was actually, I think would be helpful, is to set some objective metrics when we can both turn off and turn on a mask mandate. So it may hopefully lead to off-ramping, but it may also lead to, if something else happens in the future, as opposed to us convening a meeting and arbitrarily deciding if transmissions go back up, the mask mandate would go back up. I think objective metrics would really help get, quite frankly, all of us get out of the business of turning this on and off, and it actually would be something objective that, you know, we could kind of point to that it actually is based on data and science. And obviously, the other piece, there'd obviously be an exception if there was an outbreak in a school at Westwood. We could, you know, we can always have an exception, but and I think the metric that the Board of Health proposed, which is the Norfolk County transmission rate, is actually, it's not perfect, but it's actually a reasonable metric because it incorporates more than Westwood, kind of neighboring communities, but it's not, you know, the state or country level, which I think is probably not appropriate given both where we're at in the vaccinations rate. But it's something reasonable. There's nothing perfect, but I think it's a reasonable metric that's easy to track. So anyway, so that's where I guess come out that, you know, I guess given the Board of Health, they would say, their memo said substantial or high would mean mask on, even with 80% vaccinations. But if you reach moderate or below, masks will not be required for vaccinated individuals in a school. Of course, it's in a school of 80% or above.
Okay. Any other thoughts?
No, I agree with what Tony said. I think we absolutely need an off-ramp and need to set some goals at this point, in terms of when we can remove the masks, and the Board of Health recommendation makes a lot of sense to me in terms of looking at the local data. And I just feel like we're so close to the younger kids getting vaccinated that, I'm inclined, I know it's a real bummer for the older kids, and I know that they've done their part and we're so grateful, but to protect the younger kids and the more vulnerable older kids, I think, we're so close that to change the mandate now, given that our numbers aren't any really significantly less than they were the last time we made this decision, it doesn't make a lot of sense to me.
Okay. Charlie?
First of all, I'd just like to remember where we were a year ago at these meetings, with the science changing every week. I first want to thank a lot of people, our school administration, our teachers, Tony's committee, and the physician advisory group, Gerardo Orsini. We're very lucky that we've been doing a lot of things that have helped our kids do what we've always been wanting, is get them back to school safely. So I think I want to thank a lot of effort that we've made up until now. The second thing I think is that the concern I have right now is that the highest risk group in the population in Westwood and everywhere are the young kids that haven't been vaccinated in elementary, and the kids at home that are still young. So I think we're not out of the woods yet. And we have found this year some kids in those age groups who have been infected. So I think that's our greatest worry right now. And it was just pointed out, I think, we're going to start vaccinating these kids in November. So I think we're not out of the woods. A decision we make today isn't going to be locked in forever. We're changing as the new information comes in. But I think we want to protect these young kids who have brothers and sisters in the middle school and the high school, and they're out without masks, playing around in the fields with all their friends. So I think the best thing we can do is to continue with the masks. Not forever, but maybe another month or when the data changes. But the most important thing is we're going to be able to vaccinate these kids, make them much safer, and make us all much safer. So I strongly support what's been said by our physician advisors and to continue with the masks right now, with the hope that we'll be able to eliminate them in not too distant future when we all feel everybody's safe. But thank you for all the work that's been done up until now by everybody.
So if I could just add, so I guess what I'm hearing, if I'm just summarizing, so besides kind of the Board of Health, kind of it's basically the Norfolk County transmission rate, maybe a proposal on top of that, a second criteria for lifting the mandate in any school would be, I'm just throwing out this period, 6 weeks after FDA emergency authorization of the Pfizer vaccine for 5 to 11-year-olds, and that, who knows, then they're meeting on the 25th, but usually they prove that, they do the emergency pretty quickly after that, so they'll probably be early November. But if we do the 6 weeks, that'll give people, period, obviously, to make appointments, get the 2 shots, and have the kind of 2 weeks to be fully vaccinated. How does that feel to the committee on top of the kind of the CDC transmission?
So to clarify, we're saying, because I agree 100%. We need an off-ramp, right? We're all exhausted. And I also think, quite frankly, COVID is here to stay, right? We're not going to eradicate it. So we need to figure out a way how to live with it, because we can't wear masks for the rest of our lives. Having said that, as people have pointed out, I am also very conscious of families who have been super careful and have kids at the high school and have kids who are in younger grades that are unvaccinated. So I do think we need to take into account those younger kids, particularly with the cases we're seeing at Sheehan. I think, Tony, your 2 sort of metrics are good. I agree with them, right? I think the county should be in low or moderate transmission rate, and the 6-week authorization, 6 weeks from the authorization date of the vaccine for the youngers from 5 and up. Those to me seem fairly close, right? I think even though we're high right now, I do think that We hopefully will start trending down. So within that period of time, hopefully we'll get down to the moderate level. And I also think that we are weeks away from getting these younger kids vaccinated. So, and, you know, I'm not sure if the elementary school will ever reach that 80%. So they might not ever get to the point where they can take off the masks, but at least the high school, and I'm sure that the middle school will probably get there fairly soon too. I don't know, maybe the elementary will, I don't know. But I think those two metrics are good ones. I think that they provide a clear direction. And I don't know, those are sort of my thoughts. I just feel like we need this. We need to get out of this situation somehow. And those seem safe to me. Once the vaccine is available to people who want it, then I would be more comfortable taking off masks.
I think
Charlie?
they're very good. I think what Tony just said is an excellent guideline. And I'd call it a guideline, and I don't want to lock ourselves into it because
Yep,
we may feel
fair enough.
differently in a month. But I think for people, you know, hoping that we have some guidance on when we can start taking masks off, those are good. It's just that maybe a month from now or 2 months from now, we'll feel differently. But at the moment, I think those make sense.
Yeah, but I guess, I guess I'm a little, so I agree, but I think if there's other metrics, I'd rather have them on the table now. And look, I know there's always gonna be exceptions. If there's 30 people in a school that get COVID, I get it. I'm not, let's not be extremist here, but if there's other metrics, we don't have to decide now. I'd rather have them on the table because I think it's important that we communicate to not just the community, but also, also the 82% of kids in the high school that have done the right thing and gotten vaccinated. So I think it's important that we communicate kind of on and off ramps and not try to, because I don't think, not just us, I don't want the superintendent and her team being on a daily basis, having to deal with this. I want them to have clear guidelines. So we don't have to deny, but if there's other things we want to do between now and the next week's meeting, I'd love to have those on the table.
Well, I think one of the first things we should do, quite frankly, is apply for the exemption, right? Because we can get that paper. We know we qualify at the high school. We can get that paperwork out of the way. So Emily, if I can ask you and your team to just go ahead, apply for that exemption.
Submit it for the high school. Okay.
Yes.
I will do that. Yeah.
Because at least then we'll have it. And Tony, I agree. We do need, I sort of see both sides of this, right? I see the need for flexibility, but the need for clarity. And I think if we agree that these seem like reasonable metrics, then at some, then maybe at the next meeting or at some meeting, we say, okay, these are going to be the metrics, and accepting exceptional circumstances or a cluster or, something that where we need to be flexible, this is what it will be. And there may be times after this where, we say to the high school, mask up, right? Because we were seeing clusters, but I don't think that would invalidate the metrics that we put in place.
Yeah. I agree. I mean, I think we're saying that, yeah, of course there's gonna be exceptions. I just don't want it to be like, oh, we've got a different, I don't want to, basically what I don't want to say it's flu season, or having a bad flu season in February, mask up, because that's, that kind of gets away from the principle of objective metrics.
Right. And that goes to my point, which is, I think that COVID is here, right? It's not going anywhere. We're not going to eradicate it. So we need to learn how to deal with it. So I agree with that.
I'd also like to say in past years, we've always tried to encourage families to get their kids vaccinated for the annual flu, which is still around. Has killed between 20,000 and 50,000 people in past years. So I think it's worth just encouraging families also to consider getting the regular flu shot for their kids, just so they're not bringing that flu in, transmitting, keeping teachers out, keeping kids out because of the regular flu, which is still going to be around this year. So I think it's worth at least speaking out against, again, for encouraging people to get the regular flu shot. And it's important to keep our schools safe against that flu also.
To that point, I know, what is the plan, Superintendent Park said, I know that Department of Public Health, they're planning some additional, is it true they're going to hopefully plan some additional, COVID and or flu clinics, mobile, like we did in the past? I mean, obviously there'll be a big demand once the authorization occurs. Is that fair or not?
Yeah, I think so. I mean, there has been some talk about, DPH continuing to partner with communities around vaccine clinics like we've done in Westwood. We actually have our last scheduled vaccine clinic coming up this week on Saturday, the 16th. What I did hear just this week from DESE is that there are conversations that my understanding is that the state DPH is having conversations with local boards of health about the rollout of the vaccine for kids 11 and under, and how that might be handled at a local level. So far it's like conversations, but I don't have details. I do see that Jared Orsini is on the line and has his hands raised, so maybe
Yes,
he probably knows more about that than I do.
I was going to note that. Can you unmute Jared?
Hi, everybody. Can you hear me?
Yeah. Hi, Jared.
Hi, nice to be with you all. I just wanted to put in a plug for our annual town flu clinic. Will be held on the 23rd of October, 10 a.m. to 3 p.m. behind Westwood High School. It's an outdoor flu clinic. And we're partnering again with Wegmans Pharmacy. And folks can visit the town website, westwoodma.gov, and click on the link at the bottom left to be taken to the Wegmans site where they can register for an appointment. So
Great.
that'll be coming up for flu. COVID clinics are still being discussed in various forms in terms of when the 5 to 11-year-olds are being approved to be vaccinated. Those will be handled. As of right now, DPH is presenting a bunch of different options, but a plan has not been solidified from as to distribution or the most efficient way to reach those folks. The one thing they have said is that they will not be upping the mass vaccination clinics like we had earlier. So there won't be a Gillette Stadium, there won't be a Heinz. So none of those larger sites will be reopened. So these will be more pediatric / local clinics / possible town health departments, depending on how it all comes together. So I guess we still got to stay tuned on that.
Okay.
Okay.
Excellent. Thank you, Jared, and thank you for your guidance, not just on this issue, but throughout everything. Any other thoughts on this issue?
Maya, do you mind if I just repeat back? So I just want to make sure I understand what the
Sure.
conversation was. So I think what I'm hearing is we're discussing two metrics, which would be the off-ramp. And those two metrics are community transmission getting to moderate or lower.
Per the CDC, correct? That's the
Right.
metric we're using. Yeah.
And that a time frame of once the vaccine is available for 11 and under, sort of a 6-week period, which would allow for anybody who wants the vaccine to get it. And I'm assuming that probably getting that age group vaccinated is related to lowering the transmission rate. I mean, I'm imagining that they're probably correlated. And so the off-ramp might potentially be, I don't know, that by the time we return from December break, if a school has 80%, is that what we're?
I mean, I would think before that, if we're doing, let's say the vaccine's available November 1st, right? It would be a 6 week, and we're at, it would be 6 weeks from them, assuming we're in moderate. And that would put us sort of the middle of December.
Yeah.
I mean, I think this is something we can just say, but I think, but it could be longer. I don't know when the vaccine's coming out, but from everything I'm reading and everything I'm hearing, it's imminent, right?
Yes. Okay, great.
Yeah,
I think I understand. Yep.
To your point, I mean, realistically though, to your point, now as I think about the calendar, Superintendent, I mean, yeah, even if it's November 1, you're getting in the middle of December, so you've only probably got a week realistically left after that. So I'm fairly indifferent on that. I think, as long as people have the time, I could see the rationale for waiting until January for a number of reasons.
Right. Okay. But so I think I understand that. And in the meantime, I will submit the attestation for the high school. And what it sounds to me like is that once the vaccine becomes available for 11 and under, that we need to have a way of monitoring the vaccination rates at our other schools, and that we need a system for doing that, as we go along, so that when we know when a school has reached an 80% threshold.
Yeah. Yeah.
Okay.
I think that the pool testing, quite frankly, doesn't seem to be working. Now, granted, it's just up and running, right? And this is different from last year. I know that, and I know the state had a lot of trouble with the vendor in terms of getting the pool testing up and running. I'm sort of disregarding pool testing at this point. I mean, we're getting an 11%, participation rate. That's not helpful, right? That data.
I'd like to explore, Emily, if we could, the possibility of where do we stand relative to other towns? We're not getting a lot of participation in the pool testing. And if we're way behind other towns for some reason, and encouraging people to get the pool testing, at least to make their kids available for it, I just want to be sure we're not missing out on something that other towns have figured out how to do. I think those very low numbers of pool testing are a concern to me. I think it's a very effective thing, at least to have another metric that we're comfortable with, but it's not a comfortable metric if very few people are getting tested. And we've already found out at Sheehan that we've picked it up. So I'd just like to know where we stand. Are we way behind other towns in parents approving that their kids get tested? If there's any way of sharing with other towns our statistics and what they have, I'd just like to know more about that, because I'm very concerned about the very low participation rate.
Yeah, I can certainly look into that. I mean, when we implemented pool testing last year, one of the things that we talked about was that to really sort of leverage the maximum you can from a program as a surveillance tool, you really need about 80% participation. And clearly we
Right.
are very long ways from that. So I don't at this point sense, I don't know, the community will to sort of use that as a strategy. And I did raise that issue with our medical advisors, because I have to be honest, it takes a lot of time and resources to run one of these programs. And, the question is, should we continue? And, they do endorse the idea of continuing with the pool testing, even at the current rates. It does provide some important assurance to the individuals who are participating, and it does give us some sense of what's happening in the school community. So, as I said, the elementary rates are actually quite a bit higher. They're in the 60s. And so, we're gonna keep on with the pool testing program.
I think to kind of superintendent's point, the elementary is higher. It's not where we'd want it to be, but 60% is higher than the lower. And the high school, the big difference is, I think we've talked about between the high school and the other schools. The other schools is basically, if you sign up, we're going to get, basically, you're going to participate because we get you, we pull you out of class or pull you out of a free and you go down the hall. The high school, it doesn't work like that. Basically, the high school it's much more like a lot of high school things. They have to much more to have go somewhere, and they have to do it I don't want to say on their own time. So that's why I think you see it's just a lot more challenging in the high school. I think even if you had 80% that signed up, you're not going to get 80% participate in the high school.
Right. Well, at the elementary level, you can say, we're doing grade 1 right now.
Yeah.
And where they all are, and you can go get them, right? There's no moment in time where you can get to all the high school students before they all switch rooms again, right? So,
Right.
so
And
we
they
can't-
forget. I mean, it's not,
They forget.
you go on with your day and you forget. And I get that. So,
Yeah.
I just think that we need to be realistic, because I know the amount of time and resources that the district spends running that program. And I think that we just need to keep looking at it to make sure is, doing a cost benefit analysis on the pool testing program.
Yeah. I will just say on a positive note that, if the goal of any of these measures is to keep kids in school, the test and stay program, I think, has really been successful so far. So, we've got 47 kids in test and stay right now. Without that, they would be quarantined.
Right.
So
right. They'd be at home.
They'd be at home. And so that's 47 kids who are still coming to school. And so that feels like a very important tool, and one that is really working, to help us meet our goal of keeping kids in school learning.
Yeah. And I think it's important to keep that program in place. I think what parents might not realize is that if you are in the testing program, if you become a close contact, you can stay in school as long as you test every day. And
Right.
maybe the way we catch them is, way we get more participation is the way you described it, right? When people become close contacts, they find out about the program and they register. And it would be nice to have more participation, but
In terms of participation, I know there have been some instances where students are close contacts outside of school, and therefore they aren't eligible for the test and stay program. So I'm wondering if we could kind of flip-flop that to increase the participation by saying, if you participate in the pool testing, then you'll also be eligible for test and stay, even if it's an outside of school exposure. My concern is that by not offering these kids the test and stay, we're kind of encouraging them to maybe not be as forthcoming when they're a close contact. So it seems like it would benefit everybody involved to reconsider that.
Yeah, I don't know that we are able to do that, Amanda. So the test and stay program is run through the state and we're following their protocol and using their test kits. And when you do a test and stay kit, it's actually connected to software. Like you've got to be there scanning it into the system and the result is timed through the computer, right? So,
and I think that the guidelines for that program specifically call out school related exposures, right?
They do. And, we've inquired about that. And the explanation is that they think that the use of the rapid antigen test, they think is a good measure for test and stay for potential school-based exposures, because the school environment is a relatively controlled environment. And so they think that given the other mitigation measures in place in schools, the likelihood that a school-based close contact is going to test positive is low. They say that they don't endorse that as a method at this point, at least for out-of-school exposures, because that's a less structured environment, I think is the explanation that we got. And so they do require a quarantine protocol for that.
It's a great program.
It is. And I will say we do have a limited number of rapid tests that it's a different thing. It's called EMED, I think. And those are for students who are in our test and stay protocol in order to participate in school-sponsored events on the weekend. So there are ways that we can facilitate that as well.
So if you're a close contact and you're in this test and stay program, you could still participate in weekend sports. School-based weekend sports.
That's the part that we're in charge of, right? Yeah.
Okay. All right. Anything else on this topic? No, so I think we've got some information. We've got some to-do lists here, some to-do items. Okay, I'm going to move on to new business. Any new business?
Actually, one other, sorry, maybe just for the committee. So Superintendent, I think one thing we just needed, I think we talked about, and I think we could communicate, is that given the liability and given the winter, the tents at some point, we're not going to have tents up in January. Is that fair?
Yeah, that's fair. Okay. The tent companies won't allow us to keep, they're not winter rated, the tent.
So,
yeah.
Oh, go ahead. I was just
we're really thinking about that, obviously. And, when I read that the 11 and under crowd is going to be eligible for the vaccine soon, that gives me great joy because, at some point we just need to be able to have elementary lunch again and middle school lunch. And, I see the ability for those students to be vaccinated to be the off-ramp for that process.
Yep. So sort of similar time frame, right? When the masks can come off in the high school, the kids can go back in the cafeteria in the elementary schools. Is that what we're thinking?
I need an operational plan for lunch. So
right.
I am absolutely thinking that once it is possible for elementary students to be vaccinated, and as Tony says, that might take 6 to 8 weeks to make sure that everybody who wants to be vaccinated can be vaccinated, then yes,
okay. And presumably
that will be the end game, and we will
right.
need to have lunch again.
And that won't be tied to transmission rates. I don't think it can be. I don't think it should be, I should say. I think that the vaccination piece is the key piece for getting the kids back in the cafeteria, because if we need to, or operationally, if we say you can only be in low to moderate and then we go to substantial, you guys would have to change the whole program. And I think that that's not doable. And I
Yeah,
don't know.
There are operational realities. I
Right.
would
So
say. And, you know, we've been with yes, there are operational realities. And so we're looking ahead to a time when we can get our lunch supervision plan back to what it once was.
okay.
Yeah.
All right. We just need this vaccine.
Yes.
Okay. Any new business? Nope. Okay. Can I get a motion to adjourn?
So moved.
Second,
All right. I'll do a roll call. Charlie Donahue,
Yes.
Amanda,
yeah.
Tony,
Yes.
and I am a yes as well. We are adjourned. Thank you, everyone. I hope everyone has a wonderful day.
Thanks.
You too.